Hello, this is Dr. Dan Kahinka. I'm an industrial organizational psychologist, and in this video, I'm going to review over the many different specializations there are in the field of psychology. To do this, I thought it might be interesting to go ahead and review over the many different divisions in the American Psychological Association. And while I'm doing that, I will not only review the specialization and describe briefly what it is, but also the various career opportunities and research topics that are within each of those various categories. I'll provide you, not necessarily for everyone, but hopefully I'll provide you some different ideas and that will develop perhaps an interest in a certain area of the field of psychology for you. As you can see here, this is only a few. We'll be going over these in great detail. Like I said, I'm not gonna necessarily discuss every one in too much detail. It'll take too long, but I think by the time that this video is over, you have a pretty good idea of the whole wide variety of specializations that are in this fascinating field. So let's begin. First off, general psychology. General psychology is an area which, as in the name, it's general, and many different people are involved in the field of general psychology because maybe they're not quite sure of a particular specialization that they want to go in. And so they enter this area of psychology because, as many people know, once you're done, for instance, with your education, then that's when, once you get out there in the workforce, that you may really discover something that you're interested in. I know that for myself, I've helped many students in this area research different topics that you will find perhaps fit in some of these different areas of specializations, but from looking at, for instance, teachers in education, looking at stress, perhaps looking at various challenges with mental health. So this is a very vast area, and it's a good transition into some much more specific areas in the field of psychology. Teaching of psychology. I want to emphasize that this is a teaching of psychology, not necessarily a psychology of teaching, or educational psychology, which we will discuss after a while, but the teaching of psychology. So perhaps this particular specialization is for someone that wants to be a teacher, a professor in the area of psychology, and they want to learn various areas, various techniques, I should say, of how to teach in the field of psychology, because teaching psychology can be very different than perhaps teaching math, history, and so on, although many of those things are also part of what we do. As far as research goes, examples of research might include, for instance, an experimental study on a particular method of teaching psychology where the investigator looks at how students perform before and after a certain technique is applied. Experimental psychology and cognitive science. One of the advances early on in the field of psychology was the ability to do quantitative research and to perform experiments in the field of psychology, just as I previously mentioned, where perhaps like in the previous example, not only are we just looking at psychology as a theory, we are also taking it to the next level and applying that and better understanding human behavior. So in that previous example, looking at how some sort of idea that applies to how people learn psychologically is applied in an educational setting, and we perform an experiment by introducing some sort of variable, such as a teaching technique, perhaps a way to motivate, something like that, and discover the causal effect. This is a good transition to quantitative and qualitative methods. As you will see, there is a significant importance to each of these and a relationship between quantitative and qualitative methods in the field of psychology. While quantitative methods are generally more concerned about the measurement of various factors and understanding perhaps relationships between those various variables. Qualitative methods is a good partner to quantitative because qualitative methods looks more in depth at what is occurring, perhaps why something happens, how people feel about certain behaviors. Next, behavioral neuroscience and comparative psychology. Once we get into the area of neuroscience, what is very interesting is being able to actually view images of the brain and then better understand when certain activities occur, certain behaviors occur, how we can observe changes within the brain, and then psychologically be able to better understand this relationship, better understand the relationship between the physiology, how the brain changes, and the psychology. Now, as we go through, so just to take a step back here, we've already gone through 5 of many other specializations we will go through, but let's consider now as we look at these a few of perhaps the job opportunities that are available. I've already mentioned teaching of psychology, so teaching, professors. Then we get into the area of experimental psychology and quantitative and qualitative methods. So that's perhaps looking more in the area of research. And the same with neuropsychology and perhaps in the medical field. You can probably imagine the various jobs that are available within these areas, whether it be working for an education system, a government agency, a private organization, and on and on. So let's continue. Developmental psychology would be the area of perhaps let's look at children, how they develop, adolescents, how they develop, how they psychologically will perhaps be impacted by various things that occur during their development. For example, if a child goes through some sort of traumatic occurrence, perhaps abuse, something of that nature, how that can impact psychologically the development of that individual. As far as areas of not just research, but also again, as a career opportunity, once again, this can be a great area where people can go and work with, whether it be hospital systems, perhaps mental health counseling agencies, whatever it may be, when an individual has a in-depth understanding of developmental psychology. Personality and social psychology. This is an area that will look at individuals, perhaps measuring their personalities, looking at various ways that personalities can impact individuals within a social environment. Social psychology is an amazing area that looks at how people, and there'll be some overlap here as you'll notice as I talk about some other divisions, but it looks at how people socialize, how they interact within communities, that sort of thing. Continuing along, the psychological study of social issues. So there's that relationship there with social psychology and perhaps more of a focus on particular social issues that are occurring within communities and the psychological impact of those, as well as perhaps psychologically what contributes to the various social issues. You can imagine here the job opportunities that are available, perhaps even within government organizations, within, let's say, nonprofit organizations that are trying to help out communities. The psychology of aesthetics, creativity, and the arts. A little bit self-explanatory here. However, I think it's very fascinating to consider that when people are creative, to be able to better understand the psychology behind that, to be able to better understand, if you combine this, for instance, with the area of neuroscience, how the brain works, what parts of the brains work when people are thinking creatively, how it looks at the psychology of that, and what contributes to creativity, for example. Now, clinical psychology is an area that will look at perhaps mental health psychology, will look at people that need perhaps therapy, that need to go through some sort of mental health rehabilitation. Clinical psychology is a vast field that is rapidly growing, particularly as we encounter increasingly unique challenges, perhaps related to the advancement of technology, whatever it may be, that contributes to mental health challenges. The area of clinical psychology offers many opportunities for individuals to go into perhaps private practice, work for a healthcare system, wherever it may be, that they can perhaps perform therapy and help individuals. Consulting psychology has a relationship to the next area, industrial organizational psychology, which is my field of expertise. So consulting psychology could include going into organizations and helping with areas like motivation, performance, team building, leadership, on and on. However, consulting psychology could also have some overlap with some of these other areas. So as an example, the teaching of psychology. Well, you may decide, hey, I'd like to not just teach psychology, but I want to help the people that actually do the teaching of psychology. I want to be a consultant and go in organizations and help improve how teachers instruct, their instructional methods, some of those things. It could be that you become a clinical psychologist and eventually want to help other clinical psychologists. So your area of expertise as a consultant would be helping other clinical psychologists. So you can see right here, just in this one specialization, how vast this field of expertise can be. As I've already mentioned, in the area of industrial organizational psychology, that can involve going into organizations and looking at the examples I already mentioned, motivation, leadership, as well as looking more broadly at overall organizational development, looking at organizational change, and on and on. All of those people-oriented activities and challenges that are involved within organizations. And those organizations could widely range from military, government, education, manufacturing, distribution, logistics, on and on. As far as areas of study, you probably already have some ideas. As an example, one of the things that I investigate in healthcare would be stress and its impact on well-being. I also investigate spirituality and how that can impact both stress and well-being, and how that can impact, for instance, nurses and doctors and how they care for their patients. Now, educational psychology, as I mentioned previously, the teaching of psychology has a relationship to educational psychology. Now, while teaching of psychology might specialize in just the teaching of that particular area of expertise and that particular field, educational psychology is the is the psychology of how people learn, how people, whether it be differences between young people, how they learn compared to adult education. So in other words, pedagogy versus andragogy. But the area of educational psychology, once again, offers many different opportunities for people to learn how individuals learn, which not only can be applied as an educator, in other words, as a teacher or a professor, but also as perhaps a trainer within the workplace. Because if you understand how people learn, obviously that translates into helping trainers, and it could be helping managers to help train the folks that work for them. Or consider this, education psychology could apply to parents, for instance, and how they help their children develop. Now, school psychology, here again, some similarities with educational psychology. However, perhaps going beyond just education, but also looking at the school systems themselves, and perhaps the psychology involved with the teachers, the employees, the leadership, some of those various things. Counseling psychology, we might consider having a relationship to clinical psychology, but perhaps focusing more in depth on actually counseling activities and some of the methods that can be used. So when individuals are working and counseling individuals with various challenges, not only do we learn about the many challenges that people have that we can help them with psychologically, but also the methods that can be applied. Similar before, as I mentioned, in the area of healthcare, mental health counseling, helping people clinically, all of those areas that fall in this category, many opportunities that are available out there. Now, let's stop for a moment and consider some of the research opportunities. You can see that in these various topics, perhaps you're already considering, for instance, in the area of industrial organizational psychology, if that's something that interests you. So there again, we can see if we do experimental research, perhaps how a particular training program impacts performance among employees. In the area of school psychology, perhaps we introduce a new teaching technique that not only can help the students, but perhaps even helps the teachers become more engaged in their educational efforts. Let's continue along. 3 more to go through, and then I have actually many more beyond that, but 3 more here that you can see in front of you, including psychologists and public service, military psychology, and adult development and aging. And if you look at this, look at the dramatic differences between these. So psychologists and public service, that can include, we go back to teaching, as well as all those other areas of public health, of public education, and on, which is very different again now from military psychology. So now we can look at, in the area of the military specifically, because as an example, if you look at motivation, how individuals are motivated within the workplace is very different from how people are motivated in an educational setting versus how people are motivated within the military, and the methods that are used, the techniques that are used. And that's just an area of motivation. Of course, there's the psychology behind the leadership within the military, and on. Now, adult development and aging, again, very different from all of these things we've talked about already. So look at, we've gone through, almost 18 different areas of specialization, and you should already be seeing how, while there is some overlap, while there is some similarities between these various specializations, they're also in many ways unique. As an example, adult development, while similar, let's say, to developmental psychology, this is an area of expertise specifically with adult development. And the aging part of that is, as we age psychologically, the things that occur, how we begin to psychologically manage our behaviors and things that we encounter. So let's go ahead and we will continue along here. Now, as we look at the next group here of divisions within the American Psychological Association, which includes these various specializations, let's continue to consider not just the research opportunities that are available, but also, again, the areas that you may be interested in working. It is so important in the field of psychology that you consider what you will really enjoy. Because if you enjoy the work that you're doing, if you're engaged in the work that you are doing, that can translate into being more effective at what you are doing. For myself, I absolutely love industrial organizational psychology, and I also love teaching. I love training. So I do all of those. I teach people, I go into the workplace, I train people, and then also I investigate and I research topics that are within the area of industrial organizational psychology. So continuing along, applied experimental and engineering psychology. You can see there how perhaps there's some unique characteristics associated with this specialization, including, I love the word applied, because for myself, in the field of industrial organizational psychology, it's an applied science. We want to be able to take the information we learn, go into the workplace, and apply it. So here, applied experimental and engineering psychology, we can perhaps look at various ways that we can perform experiments in an applied setting and help out individuals, for instance, within the workplace. Rehabilitation psychology. Now consider this. When individuals experience some sort of debilitating activity, debilitating accident, whatever it may be, and they have to go through rehabilitation. It could be psychological rehabilitation. It could be physical rehabilitation and the psychological impact associated with that. It is so important, not just for those people that do physical therapy, so they're the ones that understand the body and the chemistry and so on that's associated with how people function physically and how they can be rehabilitated, but there is that psychological relationship that is associated with that as well. Because if people aren't motivated, for instance, to rehabilitate, then the other efforts perhaps are futile. It's a waste of time. Consumer psychology is an area that I have a little bit of interest in myself, because what consumer psychology can be is, for instance, if you are interested in sales and marketing, you may be interested in psychologically, for instance, how we can influence the behaviors of consumers, not just on the commercials and the various marketing messages that we put out, but also on perhaps how we are selling products and services and understanding the psychology behind the consumer. Theoretical and philosophical psychology, that area, if you are more interested perhaps, as an example, in the history of psychology, more of some of those initial theories that developed into all of these various specializations you see here, and the philosophy behind that, the philosophical underpinnings or the philosophical foundation of the various areas of expertise in the field of psychology. Behavior analysis, this is an area that specifically would focus on how people behave, why they behave certain ways, and investigating behavior, and again, looking at the psychology behind that. So if you see, for instance, individuals bullying others, so you have some kids and they're bullying others and treating them badly, to be able to analyze that behavior and better understand not just why people become bullies, for instance, and why they do the bullying behavior, but then in turn understanding the behavior, let's say, of the victims, of the individuals that are being bullied. The history of psychology, that can have perhaps a little bit of overlap with theoretical, philosophical, but primarily focusing again on the history of the field of psychology. And that can include any of these areas. It could be the history of industrial organizational psychology or health psychology or education psychology, or the field as a whole, the origins of the field of psychology, and how this idea that we can examine people, how they think, what they do, their behavior, and actually be able to perform experiments and document and have quantitative evidence that shows that these things that we oftentimes cannot see, like stress, but that it indeed exists, and we can do things to change that psychology. So you can learn about the history behind that. Community psychology would be interested in the area of how communities perhaps function, how people think, what their various behaviors are that are the result of how they think, perhaps due to, let's say, cultural upbringing, parenting, whatever it may be, and how that can impact the community. I would go so far as also saying that community, if we have a more broad definition, could include regions within where people live, towns, villages, but perhaps also internal communities, whether they be communities that are religious, whether it be communities that are looking at, let's say, perhaps it has to do with agriculture, so an agricultural community. So you have communities can be, again, sort of an endless list of how you might have a community and what it might consist of. Psychopharmacology and substance abuse. Now we start looking at the psychology behind substance abuse and perhaps how to psychologically work with individuals, at the same time be able to prescribe medications and have a more broad focus on how to help individuals with substance abuse. The advancement of psychotherapy. So psychotherapy has evolved over the decades, and as people learn how people will change behaviors and ways of thinking as a result of psychotherapy, that continues to advance. New techniques, new technologies, all of those things, whether it be, for instance, as an example, an advancement in the area of psychotherapy would be online psychotherapy. Never had that decades ago, whereas now therapists have the ability to go and virtually help people, and that can include, of course, around the world. Psychological hypnosis. This would be an area that would specifically focus on hypnosis, as well as psychologically perhaps why people get hypnotized, how they get hypnotized, and it can help individuals perhaps in the area of psychotherapy. So again, you can start seeing some of the overlap, yet how unique some of these specializations are. State, provincial, territorial, psychological, association affairs. Boy, that's a long name. So perhaps looking at the various, it could be laws, ethics, individual characteristics associated with various provinces and territories, and the psychology involved in that. Humanistic psychology. One way I might describe that would be looking at individuals and looking at perhaps various behaviors and looking at people as unique and really focusing more on them in a humanistic way. I guess that's sort of a broad definition. Intellectual and developmental disabilities, autism spectrum disorder. Now consider first off, autism itself, autism spectrum disorder, the challenges that are involved there for people that have those challenges, as well as that can include their caregivers, their parents, the people that are working with them, trying to make people that are on the autism spectrum disorder live more productive, happier lives, as well as other developmental disabilities. Here again, not just working with the people that have these challenges, but their friends, their family, people that are teaching them. As we continue along here, environmental, population, and conservation psychology, I would perhaps describe for you maybe a good example of this might be not just psychologically why people want to conserve and perhaps look at the environment in certain ways, but also the psychology behind maybe changing some people's behavior and why they think this way, why some people maybe, let's say psychologically, more willing, let's say, to be more environmentally conscious, why other people are not. And so again, psychologically, what that relationship is. The psychology of women, shortly I'll talk about. There's also a psychology of men, but the psychology of women. So here again, women are very unique to men. We have our differences as well as our similarities, but the psychology of women will specifically focus on women and perhaps why certain behaviors occur, thought processes. Again, this can be tied into developmental psychology, how women develop, and all of those various things that are associated specifically with women. Pregnancy, and on and on. Psychology of religion and spirituality, that's my primary area of interest, where I look at the combination between psychology of religion and spirituality and its impact on the workplace. That's that industrial organizational psychology side of me. So what this has to do with is worldwide, over half the population, for instance, is involved just in a monotheistic religion. And so why is that? What does that have to do with how we live? How does that impact our livelihood and our performance in the workplace? And so what I've learned there through my research, for instance, is people that are more spiritual have less stress, greater well-being, and how that translates into performance in the workplace, you can perhaps imagine. Child and family policy and practice. This perhaps has more to do with not just the laws, but the methods that are applied when it comes to child and family psychology. And then finally, for this group here, health psychology. This can have perhaps a relationship between both the physiological and the psychological. As an example, when I perform my research on the psychology of spirituality, I look at individuals in the healthcare field. So I also understand to some degree health psychology. And in this case, when I perform my research, I understand as I've gone through the literature that spirituality has a relationship to physical and psychological health. Well, we have a few more to go through here. As you see here, and this will be the last of our list, but we're going to go through this again, so hang in there. But you're going to see again some various areas that you yourself may be interested in. So psychoanalysis, again, how people perform therapy, how they help individuals in the field of clinical psychology. Clinical neuropsychology, there's some overlap there, of course, with psychoanalysis, but this also has to do with, again, neuropsychology, how the brain, how we can capture images of the brain and how that changes. And in a clinical setting, when people have, for instance, some pretty severe challenges at times, how that brain changes, what happens, what kind of things we can do to help these individuals. American psychology law, a specific focus on laws within America, and that specifically are focused on the area of psychology. And these, of course, worldwide can change. And in a global economy like we have, it's good to, of course, understand the psychology, not just in America, but in other countries as well, and the laws associated with the field of psychology. Psychologists in independent practice. This has some overlap, I mentioned previously, with the area of consulting psychology. So now you're talking about people in independent practice. Are they independent therapists, consultants like myself that may want to go to hospitals and help with performance, and on. All the various areas that you may think that a person may be able to practice what they specialize in and help others. Family psychology, think about the dynamics of a family and how they can vary. And they can vary based on culture, for instance. If people live in a more individualistic versus collectivistic culture, and how families function within those. So we want to understand the psychology behind that. The psychology of sexual orientation and gender diversity, somewhat self-explanatory there, but we can perhaps see some overlap here between differences between men and women and the psychology behind that. Psychological study of culture, ethnicity, and race. So here again, people think very differently, yet in some ways very similarly. So what are those differences? And that's what you can learn in the field of psychological study of culture and ethnicity and race, and better learn how people behave, why they behave, based on how they've been, for instance, brought up, based on what they have been taught by their families, their friends, the education system, and how that can impact their behaviors. Media psychology and technology, and especially perhaps now in the world of online media and all these different ways we have access to information through technology, and psychologically how that can impact people. Sport, exercise, and performance psychology. This is something that used to really interest me, particularly when I was more involved in sports, and how people think, what motivates them. It's amazing. You can have, in the area of athletics, you can have people that physically are very capable and perhaps the most capable of performing certain feats and work in teams and do these different things, yet psychologically, if they are not perhaps motivated, if they're psychologically, there's something happening there, a barrier that's keeping them from performing, look at how that can impact their performance when it comes to sports and exercising. So very fascinating. And again, you can probably see these many areas that you can research and that you can work in and look at how, if we perhaps change some certain behaviors and do some things, let's say to build teamwork, how in turn psychologically that can affect a sports team. The study of peace, conflict, and violence. Here, why do people behave in certain ways as individuals, violent behavior, as perhaps all the way up to societies? Why is there conflict? Why is there violence? What do we need to do perhaps to have more peace among individuals and society? So understanding the psychology behind that. Why do people think the way they do when it comes to these behaviors? Group psychology and group psychotherapy. Now, one might argue that group psychology could include some of these other areas that I've talked about, such as teams. Teams are groups, so how they function. It could also include groups that are within organizations, groups that are part of culture, and then again, group psychotherapy, perhaps even a little bit different from psychotherapy with individual, but perhaps group psychotherapy. How are we able to bring people that have a common challenge? Let's say it's substance abuse, put them together as a group, work with that group to help develop people in a group setting versus individual. Addiction psychology, you already saw that we addressed this a couple times, just in a little bit different ways. And so here, maybe not so much, let's say, the psychotherapy behind that, like I just mentioned, but maybe why people get addicted. What are the causes of addiction, and what can we do to help prevent addiction? Here again, the area of professionalism, what you can do in a career, how you can address this as a researcher is fairly vast. Psychological study of men and masculinities. Here again, we already looked at the psychology of women. Now we're going to look at the psychology of men. How are men unique? How do they think? Why is perhaps their behavior sometimes so different from women? And how can men and women better interact together? In order to do that, we need to understand the psychology, not just of women, but the psychology of men. International psychology, a field that, as we can see, is perhaps expanding exponentially with the area of increased technology, globalization, organizations that are working together around the world. We need to understand the psychology, the similarities as well as the difference psychologically between people from different cultures and different countries. Pediatric psychology, so beginning to understand individuals perhaps from the moment they enter this world, babies, young children, and psychologically how they can be impacted through whether it be parenting, trauma, education. Advancement of pharmacotherapy, looking again whenever we see that word pharma, so we can start beginning to think about medications and perhaps how those medications impact people psychologically. But I would also have to say it could even have to do with people's acceptance of, let's say, medications and drug use and why people think certain ways, where some people just do not want to go and take medications, others are very receptive of that. So you can see how you can go down some different paths associated with some of these various specializations. Trauma psychology, people go through trauma in many different ways. Trauma could be due to a pandemic. Trauma could be due to war and conflict. Trauma could be due to perhaps an upbringing and child abuse. Trauma can occur in many different ways. Accidents, perhaps traumatic physical ailment, cancer, something of that nature. So trauma can occur in many ways. And what does that do to us psychologically, and how can we recover? So now in conclusion here, wow, was that a lot of information to go through, right? I do want to thank you for your patience going through all of these, and I really hope you gained a better understanding of the field of psychology, how vast it is, and the infinite number of areas that you can work in as well as research. Thank you very much, and have a wonderful and blessed day.